Hello, everyone, and thank you for joining us for this AMA CDC Fireside Chat, focusing on the fall and winter respiratory virus season. I'm Dr. Sandra Fryhofer, immediate past chair of the AMA Board of Trustees. I'm also AMA's liaison to ACIP, the CDC's Advisory Committee on Immunization Practices, and I'm delighted to host today's discussion with two superstar leaders in public health. Dr. Mandy Cohen, Director of CDC, that's the Center for Disease Control and Prevention, and Dr. Demetre Daskalakis, Acting Director of the CDC's National Center for Immunization and Respiratory Diseases. Today's Fireside Chat is brought to you in collaboration with Project First Line, CDC's National Training Collaborative for Infection Prevention and Control. Its mission is preparing frontline healthcare professionals and public health workers on how to protect themselves, their patients, and their communities from infectious disease threats. The AMA is proud to be a Project First Line partner, and we're so thrilled to have our CDC colleagues here with us today to share this update and to answer your questions. But before we get started, let me tell you a little bit more about our esteemed guest. Both have proven track records of protecting America's health and safety. CDC Director Dr. Mandy Cohen is an internal medicine physician. She received her bachelor's degree from Cornell, her MD from Yale, and did her internal medicine residency at Mass General. She also has a master's in public health from Harvard. Before becoming CDC Director in July 2023, she already had an outstanding record in public service and in leading large and complex organizations. She had served as Chief Operating Officer and Chief of Staff for CMS, the Centers for Medicare and Medicaid Services. She'd been Acting Director of CSIO, the Center for Consumer Information and Insurance Oversight. She was also involved in many aspects of the Affordable Care Act, expanding coverage, insurance protections, and new provider payment models. After her public service at CMS, she led North Carolina's Department of Health and Human Services and was praised for her outstanding leadership during the COVID crisis, which focused on equity, accountability, and transparent communication. She also transformed North Carolina's Medicaid program through the state's Medicaid expansion. In 2022, these many accomplishments were recognized and applauded by AMA when she received the AMA Award for Outstanding Government Service. Dr. Cohen's also a mom. She's married and has two daughters. Dr. Mandy Cohen, CDC Director, thank you so much for being here.
Thank you, Dr. Fryhofer. Thanks for having me.
Our other guest today is Dr. Demetre Daskalakis. He's an infectious diseases physician, and at CDC, he wears many hats. His permanent role is CDC's Director of the Division of HIV Prevention, but he's also Acting Director of the CDC's National Center for Immunization and Respiratory Diseases. Dr. Daskalakis received his MD from NYU and completed his internal medicine residency at Beth Israel Deaconess Medical Center in Boston. He did infectious diseases fellowships at the Brigham and at Mass General. He also has a master's in public health from Harvard. Dr. Daskalakis is former Deputy Commissioner for the Division of Disease Control at the New York City Department of Health. He was the incident commander during measles outbreaks in 2018 and 2019, and also during the 2020 COVID public health emergency. He most recently served as Deputy Coordinator of the White House Mpox response team, and in that role, he successfully led Mpox vaccination and public education efforts that helped halt advancement of the virus. Dr. Daskalakis, thank you for joining us today.
So excited to be here. Thank you for having me.
And we also want to thank you for speaking at AMA's Health Equity Open Forum at our June House of Delegates meeting. Your comments focusing on leadership approaches to advancing LGBTQ health were well received. And on a personal note, I really appreciated your timely updates at our ACIP meetings. So again, we are so fortunate to have both of you here to share your insights and to answer our questions. And here's the plan. First, Dr. Cohen will give an update on the current state of respiratory diseases in the U.S., and then we'll go to questions from our audience. And these are your questions. These are questions each of you sent in when you registered for this fireside chat, and we'll do our best to get to as many of them as we can. So, Dr. Cohen, I'll now turn it over to you.
Terrific. Well, thank you again, Dr. Fryhofer, for having us. here. So what I thought we would do is give you a current snapshot of what's happening with related respiratory viruses, and then give you also some new insights we have about vaccinations and why patients are or aren't getting vaccinated. And what we really need to talk about is we need your help. We are seeing too few folks get vaccinated this season. And so we're hoping you can help us as we go through. But you'll see on the first slide here a snapshot of what we're seeing in a combined way across COVID, flu, and RSV. We are making sure to look at that as a whole here, because we know when someone walks into your office, you are figuring out what is going on for them. So we wanted you to see this combined view here. And what you can see is as we get into the winter season, we are seeing more of all three of those viruses. You are seeing the blue line, which is flu, probably be the most accelerated, but we are also seeing an increase in COVID. And for RSV, that has been picking up for about 6 to 8 weeks already. And we actually are probably near the peak or at the peak of RSV infections. On the next slide, you can see just with a little more granularity in terms of percent positive. So for RSV is that purple line. Again, you see that it has peaked. We've seen 1 week of decline. We'll see if that continues. But for COVID, you are seeing that continue to go back up, and flu season started just before Thanksgiving and has been rapidly accelerating. We are seeing on the next slide, you can see where we are seeing most of our respiratory illnesses. This is just a snapshot of influenza-like illness activity. We get daily emergency room updates from about 80% of emergency rooms across the country. And this is what it's showing us. And so you're seeing more of the respiratory illnesses in the South, a bit out in California, some in the Midwest. So we are seeing across the country more and more viruses across the board, as expected. So I don't think we're seeing anything out of the ordinary here, but I know for those of you who've been practicing prior to the pandemic will remember this time of year having some bad flu seasons and RSV on top of it, and parainfluenza and pneumonia. That we know this time of year we're going to see more respiratory illness, but then now we add COVID on top of that. And what you could see from the charts before is that COVID is still causing the most number of cases, the most number of hospitalizations, and the most, unfortunately, number of deaths that we're seeing week over week. So while we all wish we could leave COVID in the rearview mirror, it is still here with us. And so we need to make sure that we are continuing to take it very seriously, just like we want to protect our patients from flu each and every year. We need to continue to protect them from COVID, and we have new tools for RSV as well. So the next slide here, you can see what is our current recommendation in terms of vaccination. Again, vaccination continues to be the best tool to proactively protect our patients. For COVID-19, there is a new updated vaccine recommended for everyone 6 months, and older. For influenza, again, an annual vaccine also for 6 months and older, with adults who are over 65 getting an adjuvant or a higher dose vaccine. And for RSV, this is historic. This right-hand column did not exist last year. So this is really exciting. So for the first time, we have an RSV vaccine for adults 60 plus, and I'll go into more detail on this because it is new. And in addition, we have an RSV immunization for our infants. It's called nirsevimab. It is a long-acting monoclonal, we made the recommendation earlier this year for it to be available for all infants under the age of 8 months. There is also a new vaccine for pregnant moms, for those who are between 32 and 36 weeks pregnant, and is recommended to be used seasonally. Again, if you're 32 to 36 weeks, you build up those antibodies during that time and pass them along to your baby, who is then protected. So it is meant to use either nirsevimab or the RSV vaccine, either one of those to protect folks. You only need one of those products to protect folks, but it is really a game changer. So we're excited that we have more help than ever before and more tools than ever before. So all that being said, we're excited about these tools, but on the next slide, you can see here is that we aren't seeing the uptake in vaccines that we would like to see. We're seeing about 7 million fewer flu vaccines administered to adults this year compared to last year. And for COVID vaccines, we're only seeing about 16% of adults getting the updated COVID vaccine. On the RSV front, we have information about the vaccine for older adults, and again, about 16% uptake for that. And we acknowledge that is too low, and it is one of the reasons we wanted to have this conversation. And again, thanks to the AMA and Dr. Fryhofer for your efforts here, because this is going to be a team effort. So what I'd like to do now is transition to show you some data that we've collected about why folks aren't getting vaccinated, but I'll get you the punchline, which is your voice matters. The voice of the physician matters so much in whether or not folks decide to get vaccinated. And so we want to also give you some tools to help. And it is not too late. I think I just want to reiterate for what we saw on the earlier slides, we are still at really the beginning of flu season here. We are seeing COVID go up, but we do expect that to increase. We still have an ability to impact those two curves here in particular. So next slide here, let me go through some data on what we have found in terms of why our vaccination rate's so low. We regularly monitor this through surveys of why people report that they remain unvaccinated. And so when we look specifically amongst people who said, well, I'll probably get vaccinated or I'm unsure, we wanted to dig in there because they want to get vaccinated, they're unsure, but they're open to it. They still haven't yet done it. And so we want to really understand that group in particular. And there are a few different reasons. You can see the top reasons here are actually different across the different vaccines. So it is important to understand the differences when you're talking to your patients. So for COVID vaccines, the top concern here is worry about side effects. So they want to talk through what we know about the data, safety data, and the side effects data for COVID vaccines, and we'll go through that. For flu vaccine, it's really more about haven't had time. And so we have some strategies there for you as well. And then on RSV vaccine, we're actually seeing something very different. Far and away, you can see 29% there. The number one reason was that their doctor didn't recommend an action. So they didn't think it applied to them. So again, it is new and we're all getting to know this new vaccine, but a huge opportunity there for the physician community for us to make sure we're protecting folks. That's why we'll dive into RSV even a little deeper. But we know we can do better than we're doing, and I really appreciate your help. So let me dive into a few now tools that we've put out there to address these specific top concerns that we're seeing. So on the next slide here, we want to talk specifically about someone who says, well, I didn't know that this vaccine was recommended for me. So what could you do as a physician right in that moment? Your strong recommendation in a patient visit is one of the most important things you can do. People are coming in for all sorts of reasons in and out of your offices. And we have created a short conversation guide for healthcare providers with specific phrases that are backed up by evidence that show that help you have these kinds of conversations. For example, instead of, do you want to get your flu shot today? It would be specific language like, you're due for your flu and COVID vaccines today. I've gotten these vaccines myself and recommend them for you too. So it's just some additional language and just to help you have a important conversation and bring this up to your patients. Because again, a lot of why they're saying they aren't getting vaccinated is because their doctor didn't bring it up. So really using phrases again like, hey, you're due for your flu or your COVID vaccine today. I've gotten them and I recommend them for you too is really powerful. On the next slide here, What about for those patients that they keep forgetting? It's not top of mind. They don't have enough time. We also have some new tools for some reminder languages. I know a lot of you use patient portals and text reminders. We want to make it as easy as possible for you and your staff to do this. So we have some guides here for folks about how they can do that. We have it in English and in Spanish. So we hope that would be helpful for you to remind folks to come in and get vaccinated. On the next slide, one more tip and tool here is about folks who say, I'm not sure. I'm not sure I want the vaccine, and it is an opportunity for a conversation. And this is stuff I know that you know well, but how do we think about using motivational interviewing? We know you do it in all aspects of what you do, whether it's about medication adherence or what have you, but this is an opportunity, and again, just give you some words maybe to help with this conversation. Like, I hear you. If it's okay with you, I would like to spend a few minutes talking more about the fall and winter respiratory vaccines. Again, our conversation guide is developed and evidence-based on what providers told us they need, and in terms of having tips to have these important conversations. And I think it's important to acknowledge that you may need to have more than one conversation. You may have an intro conversation. Someone needs to digest that information, and maybe it's on their next visit, whether they're coming back for a blood pressure check or diabetes check or what have you. Maybe it's that next visit that you come back to it yet again. And we know that this is time intensive. This is all about building relationships and trust with your patients that I know you have, and how do you take that to the next level? So again, hopefully some of this can just be one more thing to be helpful in your arsenal or your toolbox here. On the next slide, just also a bit more on the data front, right? For the patients who are saying, hey, I want to really understand, if we can flip to the next slide, tell me about the benefits or the side effects of this. I want to make sure that you are armed with the best information about side effects. Again, generally, we are seeing very mild side effects, pain in the at the site of the injection, a sore arm, maybe feeling a bit fatigued. Again, Advil, ibuprofen, or Tylenol seems to clear that up within 24 hours. When we look at anything severe, these are incredibly rare events. When something like, for example, myocarditis popped up, we were seeing that in adolescent males at slightly higher rates, but it was really when we were doing the 2 doses of the primary series of COVID vaccine. We really aren't seeing it when we are just doing the updated booster, which is both just a 1 dose and a smaller dose. So it's really important to help folks understand the risk of what it means to not do it. Certainly, they want to talk through the risk of what it means to get vaccinated, but we want to talk through the risk of what happens when you don't get vaccinated. And with myocarditis, for example, you are 5 times more likely to get myocarditis from the actual COVID virus than from the COVID vaccine. And again, reminding folks that we've given out almost 700 million doses of the COVID vaccine. Yes, it is new, but it is one of the most looked at and studied vaccines that we've had in history. I also want to dive in here. So that's some information just about some of the COVID vaccine, and we're happy to go through even more of the evidence and the data. And as Dr. Fryhofer was saying, she is one of our advisors on those committees, right? We have practicing docs and vaccine experts, immunization experts on these committees who are looking at the risk and the benefits when they make these recommendations, so you can feel confident that AMA is represented as those decisions are getting made. So next slide here. I wanted to just dive in these last slides on RSV, since it is new, just to remind folks again about these RSV vaccines, because we are still seeing gaps in recommendations for our older adults in particular. And as you saw in the data, one of the reasons folks aren't getting it is that it wasn't recommended, so they assume it's not for them. So a couple of reminders about RSV. Wanted to remind folks that RSV results in about 60,000 to 160,000 hospitalizations each and every year, and sadly as many as 10,000 deaths among those who are 65 and older. And the folks who are at most risk, it's not going to be surprising to this group at all. The folks who are at more risk have more underlying medical conditions or they are folks who are really frail, advanced age, they're residing in a nursing home, or they have some other underlying factor that increases their risk. But, really think about the picture of who your patient is, but just know that RSV is pretty impactful for our older adults. Next slide. We want to make sure that when you're talking about RSV, that you are thinking about the patient's risk and really walking them through what is recommended. What the CDC has recommended is an RSV vaccine for adults 60 and older, and to have that discussion with their doctor about it. So you want to go through the patient's own risk for disease, and you want to go through the safety of the vaccine, and of course, talk about the patient's preferences as well. So I'm going to just end with one more slide to share with you some of the resources that we've put together to help folks talk through this. I mentioned them along the way, but I want to really shout out to the CDC team. They're really working hard to get you concise, really easy, very actionable pieces of information and resources to help you in your practice. So you can see the website there on cdc.gov. It's some respiratory virus resources for healthcare providers. It's really good stuff. I'm really proud of the team. They're all on Dr. Daskalakis' team, Dr. Mo Patel in particular, and her team, who's Chief Medical Officer, who's been doing some terrific work. So I'm going to wrap up there, but let me just mention one other thing about RSV and immunizations, particularly for children. I mentioned earlier that CDC for the first time made a recommendation for that immunization for infants under the age of 8 months. And there's a manufacturer rolled out the product a few months ago, but there has been some supply constraints there. I know that has been frustrating for families. It's been frustrating for doctors. Unfortunately, the manufacturer saw much higher demand than they had anticipated in terms of the level of supply. Now, I personally have been working with these manufacturers as well as others across the government to really try to accelerate the manufacturing process. We were able to release an additional 70,000 doses. There's more doses coming in January. So do keep continuing to check back if you are a vaccine for children provider or in the private market, because there are more doses coming out. And we really want to get folks this immunization. CDC did release a health advisory to help with the limited supply. So if we were going to even prioritize further than just infants under 8 months, we really want to make sure that even our younger babies are prioritized first, and to make sure that our Native American, Alaska Native folks are really taking note and being prioritized for that immunization. And I don't want to forget that we have another alternative here, which is the maternal RSV vaccine, again, for pregnant moms between 32 and 36 weeks. So just wanted to give you a bit of an update on where things stood with RSV in terms of supply. Please check back with your the private sector distributors that you use for your vaccines and immunizations to see there are more doses that are coming, and we want to make sure that they get out there to protect our kids. Okay, so with that, I know there's going to be lots of questions. So Dr. Fryhofer, why don't we pause there and we can turn over to questions.
So thank you so much for that fabulous and informative overview of where we stand on respiratory diseases right now. And you're right, it's now time for our Q&A, and these are questions from our audience. And these were the questions our audience submitted when they registered for this event. So these are your questions. The first question's about differences across COVID vaccines. Which groups are the most important for us to vaccinate against COVID? And does the vaccine really work well for all groups?
Such a really important question. And I get this when I'm traveling, and I have been traveling all over the country talking about getting folks vaccinated, about protecting ourselves this season. There are different risks at different age groups. And certainly our seniors are at the highest risk of COVID, flu, and RSV. Those over 65 are at the highest risk. And then if you look at data, and we actually have a couple more slides because this was so important that I wanted to make sure you had even a little bit more data here. So I'm hoping we're pulling that up. But what we're seeing is, as you think about risk stratifying your own patient population, it's really those over 75 who are at the highest risk. If we can go back one slide, please. Those over 75 and followed by infants who are less than 6 months are really at the highest risk. And then just below that are those who are 65 to 74. And you can sort of see that in the graph here in terms of who's in the hospital, when are they in the hospital. So really, those over 65, you want to counsel, absolutely get their updated flu shot. And remember, flu has an adjuvant or high dose that you want to make sure folks get the updated COVID vaccine and the RSV vaccine. Just a reminder on the COVID vaccine itself, I've definitely talked folks through to say, oh, I've had COVID recently, or I had COVID earlier this year, or I got that last booster, aren't I done here? The answer is really no, and it's important to understand that this virus has changed. That's the most important thing. I want you to make sure you're helping your patients understand. We can talk more about the variants, but it has changed. So even if you got COVID earlier this year, the virus has changed even within the last several weeks. So you want to be getting the updated COVID vaccine. The good news is, even with the changes that have come in the last several weeks, the updated vaccine is still good coverage for that based on lab studies. So really important to get those who are over 65 vaccinated. I do want to just note on two other age groups. So we said, sure, if 65 and plus is the highest, there are still, why did we recommend this for everyone over 6 months? And so I want to show you the rest of the data. So let's go to the next slide here that talks about our adults, 18 to 50, 50 to 64. And what we know is that the American population, unfortunately, has a lot of underlying conditions. And we know underlying conditions increase your risk. So about 70 to 80% of American adults over the age of 18 have at least one condition that puts them at higher risk of a bad outcome from flu, from COVID. So that is why we are continuing to recommend this for the adult age group. The other reason for the adult age group, we continue to see 1 out of 7 adults getting long COVID, which means extended symptoms from COVID beyond just an acute phase. So they're getting long symptoms even from a mild illness. So they're having ongoing fatigue, ongoing cough, some kind of symptoms. And so getting vaccinated decreases your risk of hospitalization and death at every age, including 18 to 64, but it also decreases your risk of long COVID. So we just want to make that point. And then last, let me do kids here, because I think we've fallen into the trap of knowing that COVID is less severe for our kids, which is true, but relatively, we need to think about COVID's impact on children. And on the next slide here, the bottom line is COVID is still impacting our children. And unlike adults, it is impacting children who don't have underlying conditions. When particularly our youngest kids, this is that top line there, when we're seeing kids who are admitted to the ICU with COVID, half of them don't have any underlying conditions, right? Then they're not preemies, they don't have asthma, they're not having underlying lung disease. There's no reason that they would have gotten so sick from COVID and been in the ICU. So we really do want to make sure we're continuing to protect our kids. I've been sharing with the American people as I do my interviews to say, you know, I'm a mom of a 9 and 11-year-old daughters. I looked at this data myself and said, look, I know what the risks and the benefits are here. And I got my daughters an updated COVID vaccine. I think it was important to do because while COVID is not as, you know, again, affects children less than adults, we're still seeing more morbidity from COVID than we are from flu. And every year we get our kids our flu shots. And so just trying to understand that relative risk is really important. So we want to make sure that we are really counseling patients at any age. Are those over 65 at the most risk? Absolutely. But I think the take-home message is that really at any age, there is increased risk, even in our youngest children. Okay. Thank you for the long answer to that question, but it was an important one.
Very important. So what I'm hearing is there's clearly no group that's at no risk of getting COVID. So everyone 6 months and older needs a dose of this updated vaccine. And I also had my boy-girl twins vaccinated. They're a little bit older than yours, but my entire family has been vaccinated. The next question addresses risk communication. With all the misinformation and COVID fatigue, how can we craft a unified message to the public on the importance of observing preventive measures like vaccination, hand washing? And how can we practice effective risk communication after the mixed messages the public heard during the COVID pandemic? Now, I know, Dr. Cohen, you received accolades for your transparent communications in North Carolina during the height of the pandemic. So let's start with you, and I'd love to have Dr. Daskalakis weigh in on this one too.
Sure. I've been talking a lot, so I'll turn over to Demetre quickly. But I think what you are hearing from the CDC now, right? We know more than we've ever known before, and we want to put what we know to work. And that is these tools that protect us. Vaccines. We didn't even get to testing and treatment and washing hands and ventilation and masks. All of these things are layers of protection that help make sure that we can weather this season. And we want to make sure we're giving folks timely, common sense solutions. We wanted you to have the deeper details today, but you can see in the survey data, the reason folks aren't getting vaccinated is there is misinformation out there and they're unsure. And the most trusted folks continue to be doctors, nurses, and other medical professionals, right? So you are really a linchpin here to help folks access those important tools to protect themselves. But Demetre, over to you.
Thanks, Dr. Cohen. So the only thing I have to add is that if at first you don't succeed, try again. So that's another really important message, because I think when people talk to their providers, it's not often that everybody says on the very first interaction, sure, I'll take that preventative intervention, I'll do that shot. So if someone is thinking about it, they're still movable. So it's really important, whether it's flu, RSV, or COVID-19, or any of the other important vaccines that are indicated for adults, to just remember, if you don't necessarily succeed on the first round, your voice is trusted. And the more that you remind people with the tools that we provided, if they help, which they definitely will in terms of communications, I think that that transparent communication and really putting it on that agenda, as long as we're in this respiratory season, even for people who may have said no to you the first time. Thanks.
Great advice. So our next question is about COVID variants, and you talked a little bit about this in your intro, but what should we know about the new variant? What is the new variant? And I'll add, will the updated COVID vaccine protect us against it?
Great. I'll start and then I'll turn it over to Demetre. So we continue to see this COVID virus change. In August of this year, we probably saw one of the larger changes to the COVID virus at that time. And what we've seen lately in the last couple of weeks is an offshoot of that August variant. So in August, we saw something called BA.2.816. You do not need to remember that arise, but it had a number of changes to it. But the good news is we can pick the variant up with our tests, that our treatment covers it. And importantly, our vaccines were effective when we look at it in the lab. Of course, we have to test effectiveness in the real world, and we're still gathering that data, but at least in the lab looks good. And as we saw this new JN1 variant, we are seeing it grow more quickly, which tells us it's more transmissible. But the good news is we don't see more severity with that variant, but it's hard to tell, right? We are seeing more hospitalizations. We're seeing, unfortunately, more lives taken from COVID. So it is hard to disentangle what is the variant and what is the time period of that we're in related to winter. But the good news, again, that our tests pick up this variant, our treatment like Paxlovid will cover this new variant. And again, in the lab, looks like we have good neutralization of this new variant with the updated COVID vaccine. But that's why, again, it's important to get the updated COVID vaccine.
Dr. Daskalakis, anything to add?
Such a minor additional plug, which is that we've been really trying hard as we learn about some of the newer variants to make sure that we communicate very transparently about them. So we have a respiratory virus update section on our webpage, which is a great place to read up on all the variants. So you may not need to remember BA286 or JN1, but the important takeaway is that we think that the updated vaccine will have an effect in reducing the severity of disease or preventing infection. Most likely the biggest gain is in preventing severe disease. But if you want to read up on these variants, we can make sure that you have our information on that update, because there are some really good posts up there to keep you up to date. Thanks.
Okay, stay tuned, Dr. Daskalakis, because this next one is for you. It's about a different infection, mycoplasma. What should we know overall about mycoplasma trends in the United States?
So we'll start with the little Mycoplasma 101. So a lot of us have learned about mycoplasma as an atypical pneumonia. So that's a strange formulation. What that really means is it's a pneumonia that in this scenario is caused by a bacteria that can be pretty mild, but sometimes has chest x-rays that look a little bit more severe. Some people refer to the sort of suite of pneumonias that look like mycoplasma as walking pneumonia. So one of the interesting things that we saw in the pandemic is, like so many of the other respiratory pathogens that we usually track, mycoplasma kind of took a break while COVID-19 was dominant. And so now that we are in a different phase of COVID-19, we're actually seeing a very slight increase in mycoplasma to about the place we were before the pandemic. So I think the main reminder to everyone is that coverage that we use for community-acquired pneumonia will cover this organism. So thinking about azithromycin or some of the respiratory fluoroquinolones, if you're treating someone with pneumonia, that will cover. And it's just to have the same sort of thought process that you had before the pandemic, that if it's coming in and looking a little like pneumonia, do the appropriate workup that you're thinking and use guidelines, focused strategies to treat people. So we're keeping an eye on it. Not looking like anything that we wouldn't expect. And also an important reminder, mycoplasma likes to have a cycle every 3 to 5 years, and we're due. Thanks.
Uh-oh, the year of mycoplasma. I hope you're wrong about that. But next question.
But let me just, so it may not be the year of mycoplasma. It's mycoplasma business as usual, as opposed to business during the pandemic.
Okay, our next question is about vaccine efficacy. And in light of the evolving nature of respiratory viruses and the emergence of new variants that we discussed, can you provide some insight into the current efficacy and recommended strategies for booster doses against flu, COVID, and possibly other respiratory viruses like RSV? Who wants to take that one?
Demetre, do you want to start with that one?
Sure. So I'll start by saying that, since we are in the middle of the respiratory season, we're going to learn more about the efficacy or the vaccine effectiveness of these current vaccines as we go further in the season. And I think importantly, I think CDC has been really committed to sharing that information in real time as we get it. So that is a spoiler alert that as we're getting data on these, we will make sure that we share. So first, thinking about the COVID-19 vaccine, the updated shot, looking at the laboratory data, looks like it has really good effectiveness against current circulating variants or strains. If we go backwards in time and think about the bivalent vaccine, it was about 65% effective against COVID-19 hospitalizations in the 2 months after getting the dose. So flu vaccines, very similarly, based on what we are seeing in the genomics of circulating viruses, as well as what we expect to be the effect of this flu vaccine, the updated flu vaccine this year, it looks like it should cover most of the strains. Important to say, CDC continuously monitors what's circulating both domestically and abroad, so that we can give a view into what we expect the flu vaccine is going, how it will function in this season. Looking at last season, it was a pretty good flu vaccine in terms of how it was able to take flu from wild to mild, as we like to say around here at CDC. And among kids, it prevented about 3/4 of flu-related hospitalizations, and in adults about half. So if it tracks to that, we'll be very happy. So it's looking like it's a great a great thing to remember to do this year as well. And as we learn more, we'll share in terms of this new formulation. And then finally, RSV vaccine. There are 2 that are approved for adults 60 years plus. And in those studies, that led to approval of the vaccine, as well as our recommendations, about 80% effective in preventing symptomatic lower respiratory tract infection and symptoms from RSV. So at the end of the day, even when these vaccines don't necessarily prevent an infection, they do prevent the most unwanted side effects of the viruses. And so though we sort of stick to this with our flu, it really is about taking these from mild to mild. So having a milder course, I think, is something that everyone is happy with. Dr. Cohen, I'll give it back to you.
Well, I'm going to ask Dr. Cohen about co-administration, or one of y'all. Can we give these vaccines together with other vaccines?
Thanks. An important question we hear a lot. So these vaccines can be co-administered, and you particularly want to think about co-administration for patients, particularly at the highest risk groups, maybe ones that you know have transportation barriers and you may not see again. So those are the ones you really want to make sure if you have them in your office, it's okay to co-administer. Now, you want to make sure patients are aware that when you get more than one vaccine, we are layering. So they may experience more side effects, meaning like a little more pain in their arm, more fever, a little more fatigue. But usually, again, these are mild to moderate. And have a conversation with patients about whether or not they want to space them out, or they'd rather just get it all done in one day. But again, these vaccines can be given in one day. Just have that conversation with your patient.
So this next question is about restoring trust. And since the COVID pandemic, maybe many people have lost trust in information from the CDC and NIH. So Dr. Cohen, what can you do to restore trust with the public?
Well, thanks for that. And one of the things that we're doing is right now, right, which is being as transparent as we can about what is the data that we're looking at, what are the messages that we're giving, and why are we doing that? So transparency for us is really important. I hope you are starting to notice, both as Dr. Daskalakis says, that we are trying to communicate even faster about what we know when we know it, which is why even in the last week, we've learned something about the COVID virus changing, and it's already out in the public, so everyone can understand what we're seeing. I think our wastewater data gives us this even earlier look, like that transparency, as well as being able to look across COVID, flu, and RSV and know how all of them are impacting a community, because no one comes in with a sticker on their forehead saying, I have COVID. Otherwise, that is why folks are so, walking into your offices and helping them navigate through this. So it's an opportunity for us to be transparent. The other part is on operational excellence. I think it is not enough for any one of us to say, I recommend this vaccine. We have to make it also easy for folks to get, right? We have to knock down all those operational barriers, whether that's transportation or insurance coverage, or just information gap, right? That operational excellence needs to be part of what we own, and public health and healthcare need to partner closely together in order to make that possible. Again, why I'm so grateful for this time today. And we want to make sure that we are lockstep together, the medical community and public health, talking about these things. And then the last is about building relationships. Again, another emblematic of what we're doing today. You all have such trusted relationships with your patients. They are looking to you for guidance. We want you to have the best information you possibly can, so you can have good conversations with your patients. We wanted to give you even more tools, more language, more evidence on how to have those conversations. But I think being transparent, focusing on that operational excellence, and building relationships are the way to continue to build and maintain trust over time.
Well, we are so quickly running out of time. There are many more questions that people had that we haven't had a chance to get to, but there was a question about testing. And Dr. Daskalakis, can you give us some quick comments on testing for all 3 viruses right now?
Sure. So great question. So first, there are home tests available for COVID-19. And again, that's really exciting. The tests work well. It really is an opportunity for folks to sort of know about their own status if they have symptoms or are potentially asymptomatic and going places where they may want to just know. So important to remember that you may need to do more than just one. Influenza, I think that there is a increasing availability of testing. Most of this is happening in healthcare. And so there can be point of care tests that are done at the bedside or at the office. There are also other tests that are a bit more specialized that are sort of PCR or nucleic acid based that can also tell you about influenza. Also, for RSV, no readily available antigen test, but we do have testing that is mainly occurring in the healthcare setting. So what's important is that if you're not feeling well, especially if you're someone who could benefit from treatment, and that specifically is for influenza and COVID-19, this is like where, as medical providers, we should make sure that our patients know to give us a call. Whether a test is a piece of the strategy or it is based on symptoms, depending on the scenario. As Dr. Cohen said, we have therapies that work really well for COVID-19 and prevent some of the worst complications. We also have therapies for influenza that work. Unfortunately, nothing yet for RSV. Important to note one question that comes up, the monoclonal antibody that we talk about for children, it's not a treatment, it's a prevention tool. So right now, nothing that we can offer on the treatment side, but plenty of options for testing. Thank you.
Well, thank you so much for all those answers. We have many more questions that we haven't had time to get to, but that's all the time we have for today. Many thanks to CDC Director Dr. Mandy Cohen and her colleague, Dr. Demetre Daskalakis, for their time this afternoon and their incredible insights. And many thanks to all of you for joining us and for your great questions. We've just heard the latest on vaccinating against respiratory diseases, including COVID, flu, and RSV from the top public health experts in the country. These are vaccines we all need to know about and if indicated, recommend and receive. The holiday season is upon us. Being protected against respiratory diseases this winter season means more time for love, joy, family, and friends. For more information about AMA's work with Project First Line, visit amafirstline.org. We promise to stay in touch with dates and times for future webinars. Thanks again for joining us and have a great rest of your day. For the American Medical Association, I'm Dr. Sandra Fryhofer.